Perfect. So hi, everyone. Thank you for coming, Marius and Derrick. Thank you for getting up very early, Derrick, because in the UK it's right now, I think it's 7, right?
Yeah, 7 a.m. Yeah.
7 a.m. So before baby duty, I have heard. So thank you for coming. I first heard about you through Marius. He connected me to AdoptADoc. I did some research and I was pretty interested to talk to you. So thank you for coming. What I would suggest is that you say a little bit more about yourself, about what AdoptADoc is. And Marius, I would suggest you do the same thing about your venture, who you are, and then I'll say a little bit about myself. I'm a sports physician. I'm a general practitioner in Antwerp, Belgium. I've been so for the last 4 years. And I'm very much enjoying my time as a sport physician and a general practitioner. And I've started a podcast recently, so that's why we are here today.
That's why we're all here. And well, lovely to be on the podcast, and also lovely to meet Marius and Jenny. So my name is Derrick. I'm a clinical oncology doctor currently based in the Treatment Center. So I also run an organization called AdoptADoc, where we connect HealthTech companies with healthcare professionals, really giving them the clinical insight that they need to build better tools. And we can talk a lot more about how it was formed and why it was formed in the first place later. But so far, so good. We've really helped out quite a few healthcare companies and really starting to grow a bit more of our presence within the United Kingdom and also the European Union, though we do take consults internationally. So that's it.
Awesome. And so on my side, Marius, I run an incubator and organization called eHealth Venture. Mm-hmm. The story with eHealth Venture started in 2019, where we had the chance to go and explore the Israeli ecosystem, which is really impressive as well, and especially for health tech. And what we found there is that most hospitals have an innovation team in-house. And that innovation team, I'm going to summarize it, let's say, very succinctly, so probably too short even, but essentially what it does is two things. One, it helps internal ideas, especially those of clinical staff, to take shape and then to be marketed or to be sold outside the hospital and just in the market. And the reverse is also really interesting. What they are also doing is collecting needs, challenges, priorities, etc., from the clinical staff, and then finding solutions to those needs with outside stakeholders.
Yeah.
So essentially, they're a bridge between, if you want, the clinical staff or clinical world, and for the better part, the engineering world. When we did the research in Belgium, we found that almost no hospital had this kind of or access to this kind of infrastructure. Yeah. But when you were speaking with clinical staff, we found that a lot of them had ideas. The most, let's say, adventurous had even gone so far as, coding some tools. A lot of it was coded in VBA and Excel and was pretty impressive, but was never going to take off as a startup, because a startup is more than a product. It's a company built potentially around one product, but also maybe around more products or around services, etc. And so that's essentially what we are doing with eHealth Venture. We try to connect multiple stakeholders so that we can essentially, bring health technologies outside of their little cocoons that they're built in typically at the start of their life and into the broader market.
That's actually amazing, because I think that's a lot of what we are hoping to do as well. And there are a lot of great programs within the UK and NHS that's hoping to accelerate the products of the health products in the UK, and one of the most notable one will be the NHS Innovation Accelerator, although that seems to be very much so for more Series A, more established brands and established products, so not so much for the early stage ventures. And does eHealth Ventures, do you guys work with any stage companies or?
Yes, pretty much, although I must say that I would argue that probably definitely as of Series B, and I think Series A is probably the gray zone a little bit for us. At some point, an organization or a startup will have sufficient funding and will be big enough as an organization to have all of the key people or key expertise areas that it needs to have. Whereas oftentimes in the earlier stages, you won't be able to afford having the clinical expertise, the QARA expertise, the business expertise, the sales expertise, and engineering expertise, and all of these things are just too expensive to have under one roof.
Yeah.
And that's where maybe sometimes it makes sense to have an organization like ours that does have all of these experts on board to support you part-time, let's say, until you can afford to take them on your own payroll. And so, depending a bit on the country, and this is why I say the Series A is the gray zone, because typically, I mean, an American Series A is is a Belgian Series, I don't know, Z.
I totally understand what you mean. I totally understand. But yeah, that's really interesting to hear, because I think that is a very valuable proposition that you're putting towards the digital health ecosystem in Germany. Is that right? And so
in Belgium.
In Belgium.
Yeah.
So it is something that very excited to hear about. And I know Belgium as a country has really developed a lot in the digital health space with mHealth Belgium, and also the government seems to be doing quite a lot in this space as well, isn't it?
This is going to be a touchy subject probably, but let me put it this way. I think Belgium was at the forefront of a lot of things, especially at a regulatory level, when they defined the mHealth pyramid in 2018. I think we were one of the front runners in Europe at that level in defining regulation. But we are now 2023, and the first company is yet to graduate from that pyramid. So I think there was probably some nice momentum at the very beginning, but that never actually materialized in what it should have materialized into. And so in that respect, to be completely honest with you, in our pitch in eAdventure, when we go to organizations and so on, we typically speak of Belgium as a laggard in digital health.
Okay.
When it comes to the actual, let's say, the outcomes that you would typically look at, the number of startups founded, the funding that goes into these startups, etc. There you will find that Belgium, in the broader sense, the Benelux area, is actually a laggard compared to many other regions of Europe.
I think that's actually very interesting, because you hear a lot of things, read a lot of things, but obviously you guys know exactly what's going down on the ground itself. So thanks for sharing the experience.
Yeah, my pleasure. But I'm not surprised, because a lot of reports will look at whether a country will try to categorize countries based on what they have in place, and versus what they don't. And typically, a regulatory framework for access for reimbursement of mHealth tools will be one of the first things that will pop up on a report. And so, in that respect, officially Belgium does have one. And so that's why oftentimes we'll be, put in that category of, we are at the front of.
Yeah.
But again, in terms of outcomes, we're not where we should be yet, unfortunately.
Interesting. And I know we see that Germany has the DIGA, and also I've spoken to a few Germany startup founders, HealthTech startup founders, and even they tell me that the DIGA is actually really expensive to be on, and it's actually quite challenging for them to really sustain and stay on the DIGA, and they're often just getting out of the system, doing something else altogether. France has recently launched Pecan as well, and I'm not too sure how that's going, but I think that's very brand new as well. So everyone's all eyes on them as well. But I think the United Kingdom, we don't exactly have a national reimbursement system as well. So we're always just looking to do our European neighbors and is there something we can learn from them? We used to have had something, but then that went away. So I think as a general, and the United States is still very much fragmented as well. So I think we are all still very much trying to learn what's going on right now and what's the best approach forward.
So Derrick, if I understand correctly, AdoptADoc connects a doctor with a company.
Yeah.
Company is searching for someone in the clinical space.
Yes.
How did you get that idea, or how did you?
So it's actually a very funny story. So we all know ChatGPT came up in November 2022, and every single doctor was like, this is such an interesting thing. Let's see if we can do something fun on it. So I came on to LinkedIn, really just try to connect with more AI engineers and try to connect with more people in the ecosystem. And when I just came upon it, I was reading a lot of research, and one of the research from the European Union state that 87% of all AI algorithms never make it past publication. So They just sit down in a nice paper, but they never get used in the clinical setting. And one of the biggest reasons they've quoted this was the lack of stakeholder involvement. So they've not actually spoken to the doctors and nurses who will be using these tools. So one day when I just started, I think 1 month into LinkedIn, I just put up a picture of myself, a selfie of myself, and just say, "Hey, my name is Derrick. I'm a doctor in the United Kingdom, and we really need to work together to build something that's worthwhile for healthcare. And feel free to reach out to me if you want to." And back then, I only had like 50 followers in LinkedIn. But very surprisingly, in that month, 6 different companies reached out to me, including pharma as well. I was like, something sounds interesting here. So I went on to buy a domain name, AdoptADoc.com for £1. And and that week, I had 6 people reach out to me on that 1 week. And nowadays, we are getting probably 6 or 7 every 2 or 3 days, So we've really just started snowballing from there. And a very powerful experience I've had was I went to a very big conference, a very big radiology AI conference, and I went there to speak to a few people. I had an AI idea I was thinking about, but the vast majority of people were not interested in the AI idea. The vast majority of people were very interested in AdoptADoc as a concept and an idea, because a lot of them has mentioned that this is such a pain point within the industry. When I started off doing this, coming to this health tech world, I naively believed that all health tech companies will have had some clinical input, will have had some hands-on support. And boy, was I wrong, because the vast majority of people that we consult are often from a tech and commercial background. So they do have a lot of knowledge of how to build softwares. They know how to sell softwares, but they don't really have that kind of clinical input that they need to actually build something that will fit into the current clinical pathway, and also market it to clinicians, health trusts. They have no idea how the clinical pathway works. So that's what's really been fueling the need for AdoptADoc. And essentially, the world has helped me to do this, and therefore I'm doing it.
Yeah, nice. And what's the necessity, or how can a doctor specifically help a company with that kind of journey?
Yeah, I think that's a really good question, because the one thing I realized when I started doing AdoptADoc is every health tech company has a very unique set of needs. In the broad sense, and I think this is a very important thing to talk about, because a lot of startups nowadays days, especially with the VC climate, where funding is a bit more limited and where health systems are very, very skeptical about tech startups, there's a lot of macroeconomic factors that's pushing people to say, "Oh, you need a clinician on board." If you don't have a subject matter expert on your team and you're a tech startup, no one's going to take it seriously. And you see that in VC world, you see that in the health system world, you see that in conferences. So instinctively, a health tech startup understand that they need to have a clinical input, but sometimes they're not quite sure what are they going to use the clinical doctor for. Now, this could be for product development. This could be for raising funds. This could be for sitting on a sales pitch with another health board. This could be for clinical safety. It could also very much be for regulatory input, publications, writing a clinical evaluation plan for your regulatory MHRA or FDA submission. So a clinician can do a lot in that respect, especially if they are trained or they have the necessary experiences. So every startup comes up to me for a different thing. So one of the startups we consulted on Thursday say you really need someone for a clinical safety point of view. So they need to complete a digital compliance tool called the DCB 0129 that can only be done by a clinician. And we have one that says, could we have someone to sit in our product team to really guide the product team to build this product. So oftentimes startups they have like these advisors, the big name advisors on their website. But often these guys are the big guys and they don't really have the time to sit down with product team to really hash out the product pathway and everything like that. So sometimes they really do need someone like that. And oftentimes they're looking for medical advisors as well to really, especially this for the early stage startups where they have a good idea, they raise some funds, and then they're like, okay, now where do we go from? We've got from 0 to 1. Now how do we go from 1 to 10? And that's when they really need a doctor to really tell them, okay, this is how we do things, this is how we position things. You are going to disrupt the industry, so you better have these safety procedures and standard procedures sorted. So that's generally the nutshell of what we do.
Do you have like a quick example which you can share?
Ooh, a lot of, as you will be aware, a lot of these people, we do sign NDAs with them, especially the paying clients as well. So well, here's the thing, I put up a lot of my reviews, a lot of my HealthTech Companies reviews on my LinkedIn. So people can really just look directly at who we've consulted and who has left us a good review. So you can actually just keep an eye on what they're building as well. But is there someone I can share without getting into trouble? Probably not.
Be careful.
I probably will step on a few toes. But
No
just for the sake of honesty, and I'm also gathering a bunch of reviews for my last quarter. So hopefully get 10 or 11 of reviews, and I'll just put it up in the public domain in LinkedIn. So from there you can see all the different startups and all the different founders I've consulted. It's actually on my front page on my LinkedIn profile. Okay. So you can just click on that. You can see all these different startups that I consult, and therefore I probably won't get into trouble because whatever information they put out is in the public domain.
Perfect.
And Derrick, from my understanding, so AdoptADoc, the doc that is to be adopted at the moment is only you, or are there other doctors that have already signed up to the platform?
Yeah, so we do actually have quite a few doctors that's already signed up to a different. Well, sign up to different companies, so they've been onboarded into a company. So, we've done quite a couple of so far. So yeah, but truth be told, the doctor that's adopted the most is often me. So I end up. So far we've done 76 HealthTech companies. Really, over the past 1 year, we really just lots and lots of meetings every single weekend. And
Derrick, I'm really sorry, but can you repeat the number because it was a bit muffled and I'm not sure I understood. Did you say 76?
76. Okay. Yes, yesterday was 76. And we really just keep going on and on. Really just try to reach out as much as possible. And we're starting to see a shift currently. So we used to just adopt people quite casually on the feeds, but we realized that there are some things sometimes work, sometimes don't work. Sometimes it's fantastic, sometimes it works like magic. Sometimes it doesn't work very well, and there's a mismatch of expectations between a startup and a doctor as well. So we're starting to move towards a more paid model, a more substantial model that actually has configured sort of contracts and sort of NDAs and indemnity for the physician as well, because that way both parties are more at ease with what they are expecting from each other. So we've also been doing more user group studies as well. So we're bringing together like 4 or 5 clinicians, also the admin staff, also the nursing staff, to actually sit down in front of a company who's actually hoping to build something or actually building something, and then we just put them in front of them so that they can really just drill and ask them as much questions and really flesh up the value proposition of what they're building. So that was a project we've completed just about 2-3 weeks ago, and that turned out quite well.
Awesome.
If you have to make like the perfect avatar for a doctor to connect to a company, what kind of doctor or what kind of personality, what kind of skills does one need to join AdoptADoc?
Well, it's not really about. So we're currently limiting our clinician network for now. So we do have a team of 15 to 16 active clinicians in AdoptADoc, but we are, and also as a broader network, we have about 150 to 200 doctors in our broader network, direct broader network. So really, my criteria for joining AdoptADoc is really quite simple. I do need to make sure that you have the necessary clinical experience, you have the right mindset, and you don't, and you are someone that is open to ideas and not too critical, because oftentimes, as medics, we tend to be more focused on why something can't work rather than why something can work. I think that mindset is probably one of the most defining criteria for whether I choose someone to join our team or not, because if a lot of skill knowledge you can pick up as you go along, but that kind of curiosity, that kind of desire to learn, the kind of a bit of a hustler and a bit of a scrappy kind of person who can really just figure things out as they go along. That's the kind of mentality that we really need to be successful in the startup world. So that's generally the criteria that we choose, but ultimately we have to choose someone that is nice and someone that has the right experience.
Yeah. So you suggest people that don't come from school to join AdoptADoc, they have to have 10, 20 years?
Yeah,
in the
I
field?
wouldn't say 10, 20 years. I wouldn't
Okay.
say 20 years. The funniest thing is I'm probably one of the most junior doctors in AdoptADoc, and the rest of them are actually consultants, of which I'm very, very honored and pleased to have their support. But actually, it's not more about how experienced you are clinically, although I do say you do have to have a few years under your belt, because just a year or two is not going to let you see the whole ecosystem, you know. And I've been in this field for about 10 years, and I barely know everything.
You still look young, so
Yeah, thank you. So it's more about how much lived experience that you've had. You know, I have plenty of people 2-3 years out of medical school, but they've done so much work during medical school itself with different HealthTech startups. They actually know a lot of what they're talking about. So grade doesn't matter, but experience does.
Okay, good.
And Derrick, do you try to associate doctors to startups based on the medical specialty that the startup is focusing on? So will you take oncology startups, or do you go beyond oncology?
So we do all kinds, you know. So I am an oncology doctor, but because of my presence on LinkedIn, I've become very much of a generalist. So 76 companies, I think there's only four or five of them are actually anything to do with cancer at all. Yeah, because there's not that many cancer startups in the world. So most of them really come from a very broad background. We do a lot of FemTech. For one period of time, we had a lot of MSK startups coming to us, and then after that, brain health, dementia. And then FemTech. So sometimes they come in a team, and it's not as though they've coordinated. They just pop up and turn up to us. So, but oftentimes I believe in getting the right person for the right job. So a lot of, let's say, a mental health startup, there was this mental health startup in the United Kingdom, in London, achieved really quite well, but they were really looking for someone like a clinical psychologist. And I'm a cancer doctor. I'm not going to be able to help them beyond the initial level, just beyond the initial first aid of health tech. So I often, like a GP, like a general practitioner, I've always tried to say, okay, I refer you to, let's say, Dr. Faith Medegler, who's a consultant psychiatrist, and I'll let you have a chat with Faith and see where you can go, move on with her. And oftentimes I have to find the right person for the right job. And what's very funny recently, that's happened quite interestingly as well, is we get quite a lot of international companies coming up to us, and one of my friends is Preston Alexander. He's quite big on LinkedIn as well. He's trying to build something, and he was telling me that, I need someone in Portland, and it needs to be in this specific specialty. I was like, okay, all right, I'll try to look it for you. And within 20 minutes, I found someone, and I connected them, and it was like, hey, you guys should meet up and talk. And that actually worked out very well, and they actually starting to work together to build up a very successful startup. And she shouted me out on LinkedIn, and that went up to 4,000 likes. So I was like, all right, interesting. And then the next day, my inbox exploded, and I had 6 people on my inbox. So sometimes it's all about finding the right person for the right job, and you can't force a square block into a round peg.
Mm-hmm. Is it something that can be combined with clinical work still, or is it like a full-time job that you do?
No. I'm working full-time as a clinical oncologist. So
okay.
All my meetings, as you can. Well, you guys are part of it right now, because I do all my meetings at weekdays nights or weekend very early in the morning, because I have a child. So I do try to only do it in the weekends, and that's why I can't exactly move as fast as I would like to, because there is full-time job and full-time dad that's being as one way, but it's still something that keeps me going. That's why I have meetings booked up till January.
Wow. Hustling. Yeah.
And Derrick, so sorry for asking potentially a very, very direct and invasive question, but it's going to be a two-part question.
Sure.
AdoptADoc, what kind of legal structure is it? Is it a company or is it a charity or?
So I'll just clarify that very clearly for all of us, and of course for leaders as well. So AdoptADoc is a social organization. So very much we have a social model where we connect doctors with HealthTech companies. However, we also have a legal entity that we fall under. So there is a one of our direct partners, a very close partners, is called the Medical Consulting Group, or for short, we call it the MCG. So I always like to pitch to the different companies, and especially one of my good friends, Dr. Thomas Mack, who's the managing director of the MCG. I often bring him in our meetings as well, especially for the more important, more intense companies that really do need some deliverables done, and not just a very simple medical advisor. They do need like something done by date A. I'll bring Thomas on the board and we'll say, AdoptADoc is the social arm of Medical Consulting Group.
Okay.
We do a lot of our work. We started off doing a lot of our work for pro bono, so we do a lot of work for free, really helping the people, the early stage startups, for free in the initial phase. But now with the traction that we've gained and the kind of clientele we attract right now, we're starting to get a lot more paid work as well. So when there's actually paid work to be done, we'll then switch mode into the MCG, and MCG really then delivers on the job. And so far so good. We've actually completed about 3 or 4 jobs together. So I think that's a model that's working very well. AdoptADoc is very much top of funnel for the sales, top of sales funnel. We are very visible. We get approached by a lot of HealthTech founders, and I personally filter out what's suitable, what's not so suitable. The truth of the matter, and I think you will understand this, Marius, as well. A lot of early stage HealthTech founders do not have money. That is the truth. A lot of them don't quite have the necessary funds to connect with, let's say, a very high profile doctor or get them to work for 10, 20, 30 hours. But I don't think that's necessarily a barrier to prevent them from meeting the right people, because for these small guys to end up succeeding, they do need that initial help. Even though it is maybe for free, maybe for very cheap, they do need that support in the initial stages. And it's our investment in the people and the companies that they end up raising funds and they come back to us and to help. We ask for more help, and we've actually seen this happen over the past year. So, but to be fair, most of them don't actually reach that stage. So it's a bit of a gamble who you invest in. So you really do have to be very careful about, okay, this is someone suitable, this is someone not so suitable.
Okay. Because the reason I ask is that let's say in my experience at eHealth Venture, it hasn't been the case that every clinician each time is asking us for some kind of compensation for their time. So we have had, I would even say, a lot of clinicians who accepted to consult or spend dedicate a bit of time to us for free. But I would say that a majority of clinicians will, at some point in the conversation, explain that, obviously, and I totally understand and respect that their time is limited, that obviously, I mean, they bill patients for their time, so that their time is money, let's say. And so at some point in the conversation, they will ask, what the compensation will be. And generally, although it's not oftentimes explained as explicitly as what I'm about to say, what they will at least expect is to be compensated for what they would have earned if they were seeing patients instead. And I completely understand your point, and I do see a lot of value in having just being able to have these even short conversations. I think a lot of health tech startups would benefit from this. But I can imagine that if you would pay a doctor at the rate that they would earn with patients, that bill can
get very high, very quick.
Yeah, exactly.
And so let me just share our experience of how we do things as well. So there's a line that we draw, so I'm always very happy to take an introductory call with a company. In fact, I'm meeting 2 of them today, and I'm very happy to sit down, have a chat, just making friends, making the genuine social connection with someone. Because I guess because I'm a doctor, I'm very biased that way. I do love speaking to people. I do love connecting with people, and I think that's very, very rewarding. So very happy to have a chat, talk through, ideate. But there comes a line that's strong when they start to say, "Oh, can you then help me review my product? Can you give me critical feedback? Could you please write out some content for us? Could you endorse us for this? Do you mind?" I've had once a company put my name on a very large national accelerator without me knowing. And I was like, wait, I don't even remember that you guys are applying for this program in the first place. So can you please take me off, because the program director knows who I am. So I'm like, yo, you gotta, let's be reasonable here. So that does happen. You know, I understand it. Startup founders, they're hustlers, they're go-getters. They need to get as much help as they can early on. But we do draw a line. And just to give you an example as well. So the kind of quoting that we do is that a consultant level clinician. So let's say a consultant ONG, you know, who's actually fully qualified, 10 years, you know, 10 years experience. The kind of quotes that they'll give at least 200 to 300 pounds an hour, and that's great within count. And you know, this can be a very large expense for a startup. You know, and essentially that's how much lawyers charge. A lawyer would charge you 250 pounds about an hour ish. So that's the first big barrier to collaboration. How do we reach a middle ground for a startup founder who generally don't have that much runway, barely can pay themselves? How can they pay someone else so much money for something that's not quite as tangible? So you pay a software engineer, you get a product. You pay an accountant, they sort out your finances, they calculate your runway. You pay a lawyer, they set up your legal fee, they set up your company, they do your SEIS, they help you set up your structure so that you can raise funds. What do you pay a clinician for? And that's a very big question that I've been pondering myself. So there is a risk actually when it comes to working with a clinician. That is the truth. And there's no one really speaks about this, because if a health tech startup founder doesn't know how to work with a clinician, or is not clear at all what they want from the clinician, the amount of time that they actually spend wishy-washy, spending about and wasting a lot of money, and they get very disgruntled because they're like, oh damn, I paid £1,000 and this guy has not given me anything, and then they get the patients get a bad rep as a whole as an organization. So that's where AdoptADoc and NCG really comes in, because there's that, and there's one of the questions that we had further down, like what's the language barrier? You know, there is a language barrier between startup founders and doctors. So we have to serve as an intermediary to try to understand, okay, when I speak to the health tech founders, I often have to coach them to tell them, okay, what exactly do you want this clinician for? So I was just having this conversation with the health tech founder on Friday. We just thought that thing, okay, you can't get someone to do everything, all right? And you say, oh, I want this guy for 2 hours a week, but I want them to sort out our content creation, I want them to sort out our clinical safety bit, I want to get them to come sit in our sales board. I'm just like, you're going to struggle really hard to find someone to do all these things, because it's going to scare them off a lot, and a lot of them would not know exactly at all what they're talking about. I've always coached them and tell them, especially in initial stage, do define the job scope a little bit more. So don't try to boil the ocean. Try to figure out, okay, this is the one deliverable that I really must need. I have to get this clinician for, and then let's do that job. Like, let's say 1-2 hours of work first, and test the water. Say, okay, this seems suitable for me, and then let's go from there. And if that is a relationship that you build up organically and say, hey, I really like this guy, I really like this guy, then let's carry on the relationship from there. And one of my best friends, essentially, I put him on the job for actually an oncology company, and that's essentially what I did. I say, just use him for 1-2 hours. See if you like him or not. They love him. They absolutely love him. They flew him down to London, booked a very big fancy meeting room for him, and they really, they want to bite his head off, because they're like, this is the perfect guy for me, and I'm going to pay you X amount of money because I think you are the person that's going to take us from A to C, A to B. You know, so that's the kind of approach I recommend. Narrow job scope, build a relationship organically, take it from there. It de-risks the whole process a lot anyway. So at least you're not dumping a whole chunk of cash on someone that you don't know is a stay hire or not.
Yeah, I think that's a good idea. You talked a little bit about how a health tech founder or people in the health tech industry can work with a clinician. For a clinician, being myself one, I have no idea what's going on in companies. Zero. I have no schooling in that, no training in that. If someone like myself, a clinician, wants to do some consulting work, are there some books, courses, trainings that we can follow to prime ourselves for that kind of work?
That's actually a very good question, actually. Well, there's lots of stuff. There's lots of stuff out there for you to read, and it really depends. So yeah, that's a very good question. So one of the other things that we get a lot from AdoptADoc is tons and tons and tons of clinicians, especially junior clinicians, even very senior clinicians reaching out and say, hey, I'm very keen on joining this startup world, consulting world. How do I start? How do I begin? And it's a huge topic. So I'll list out a few interesting companies to look out for, and because these are the people that actually do quite a few programs. So the most famous on-brand company will be called Byte Labs. The Byte Labs HealthTech Fellowship in the United Kingdom. They've really just started about 1-2 years ago, but they're very popular. So at a very basic level, it gets you in the commercial ready mindset. We also have Medic's Footprint. So Dr. Abina, this company has been there for about probably a bit longer, and they do a lot of like a proper course itself to really mold the mindset of the clinician to understand how the consulting world goes for. But actually, consulting and medical advisory is actually a super broad term. What is it actually? What is it exactly? It's a very vague concept that I don't think people really understand what it means. So what I've always recommend for people to do if they're interested in this field is to really follow what they're interested in. So say you're interested in sports medicine. So obviously you know very well what sport medicine is, but also to see, okay, what is the added value that I can bring to the game? And this is when you start to speak the language of the company. Instead of saying, I'm a consulting company, is it product management that you're better at? Is it clinical safety? Is it regulations that interest you more? Is it sales that interests you more? Is it procurement that interests you more? It's having that second hybrid skill that what makes you extractive. A clinician as an individual person it's good, it's important, but it's still a bit too vague for the company to really bite onto you. So, the friend I told you about that really got accepted and adopted and hired by the cancer company, he has a dual skill set. He is a very brilliant oncologist, but he's also a software engineer. So he knows how to code, and this is not just a simple doctor who codes. He had 10 years of engineering experience before he became a doctor. So having that dual diverse skill set really sets you up as different as compared to the thousands of doctors on LinkedIn saying, "Oh, I want to do medical advisory work." It's like, what is your unique skill set that you bring to the company that can solve a business critical problem? That is what I think will set people up. So that's my general advice.
Brilliant. Yeah, thanks.
At
HealthVenture, we call these kinds of profiles unicorns.
Unicorns, exactly. I call them that as well. I exactly call them that. I often the start of they come to me and say, so describe the ideal clinician profile bracket, the unicorn clinician that you're looking for. But to be fair, sometimes these unicorn clinicians are really hard to find. You want to find the exact person in the exact specialty with the exact skills that you're asking for. It's like playing a game of. It's just playing a very highly improbable game. But sometimes you try to find the nearest person that you can get. But sometimes you'll be surprised. The world is big. You might find someone that's quite suitable.
Derrick, maybe to follow on to Johnny's question, it might be a little bit repetitive to what you've already answered, but I'm really impressed that you as a clinical oncologist spend so much time in improbable times of the day as well, with these startups trying to first and what they're working on, and then coaching them or guiding them, advising them on, okay, this is unclear to me, or this could be better, etc. Especially with early stage startups. I don't know if for you it's the same, but if I look at the startups that come into HealthVenture, I would argue that a solid 20 to 25% of them, after the fifth sentence, and I hope I don't get killed for what I'm about to say, but after the fifth sentence, I will have something like, whoa, this person is really, really late to the game, or like there is really nothing novel in what I'm hearing here, or, you know, I have no clue how I can turn this, or I can help this person make a successful company from this. Like, so, and that brings me back to what you were mentioning earlier of, you know, needing to have this curiosity, this intellectual curiosity of, you know, what are these people working on? So what is it for you personally that makes you spend or dedicate so much time to these?
Yeah. So first of all, Marius, I completely feel it. I think I'm sure we can have a few beers and few coffee just talking about what you've just initially described. You know, it's very it's a topic of great amusement to me sometimes. A lot of health tech founders that I speak to, you know, because they are all from very tech and very commercial background, and they don't really understand healthcare very well. They're all, first of all, I must pre-qualify by saying all these health tech founders and innovators, they're all very lovely people. They are only in this sector because they want to really help. This is not a very easy sector to penetrate, so you really need to be a bit crazy, a bit noble if you want to work in this field. But a lot of times, the truth of the matter, I believe in being honest. I believe in being critical in the early stage, because an honest feedback is what's going to help someone and stop someone from wasting a crap ton of time, 6 months building something, or 100, 200,000 of their runway building something that no one. So the amount of times I actually had to rip certain companies' ideas to shreds and to really break them down, to tell them, okay, this will just not work because of what you're just describing. This is not how healthcare works at all, you know. And I'm coming from a healthcare perspective. I'm not even talking about a commercial bit, you know. And we all bring together a different parts of the puzzles. And if something just isn't viable from a clinical setting and is not what doctors want or clinicians want, especially if it pitch as a clinician tool, then we certainly cannot proceed from that point of view. And you need to rejig your value and really think about how you're going to approach things in the first place, you know. So that's one thing. As to what's my main motivator, and why I'm still doing this after 1 full year, it's really just the passion and really the interest. You know, it's one of those things that I'm really excited. Every day when I wake up, like, oh, it's 7 a.m. call, I wake up at 6 a.m. just to sit down and have a chat, because it's very exciting speaking to different health tech founders and really being able to make a real impact for them. So if you can see through the reviews that I have on AdoptADoc, you know, they're always glowing reviews, because I always bring all of me to these meetings and really understand, okay, how can we help? Where are you? What are you doing? Where I think there's challenges, where are the things that I can connect you with the right people, you know. It's very satisfying what I do. I personally find a lot of personal satisfaction. I also think it's very important. I believe that for healthcare innovation to succeed, we all need to come together. And it's not just the tech side, it's not just the commercial side, the medical side, the regulation side, the government sector, the private sector, the funding sector. Everyone really had to come together so that we can build something that's worthwhile. If not, if everyone just trying to do their own thing on their own side, you've seen this as well, Marius. Bunch of clinicians very passionate about what they do, trying to build something on their own, and then it's just an Excel sheet or some very simple line of code, and they just stop right there, because how do they go from building something, or maybe even running a small little project in a hospital thing? How do they go from transforming that product that works in one healthcare sector to one that can be commercialized, that can go through the QARA, the NHRA, the FDA regulations, to go through procurement, sales, to go through intellectual property, to go through setting up a company, paying people, raising money? That whole ecosystem is massive, you know. We all bring our individual piece to the puzzle, and I feel that I am an important piece of the puzzle, but just still one piece. So that's what really motivates me to try to bring together the people that's needed to really push things forward. Because there's obviously a huge demand. Judging by my inbox, there's still a massive demand, and not just in the United Kingdom or the European Union. You know, we get lots from the African continent, which is very important. We get a lot from India, which is also very important. We get some from Australia, quite a few from the United States, not surprisingly, and but the majority from the United Kingdom, and one from Israel as well, by the way. One from Israel as well. That was the weirdest conversation I had. I was talking to the lady, and then a bomb went off the background. That was the exact day the Hamas attacked. I was like, ah! And she was just telling me, oh, you know, there's a war going on. I was like, what? there's a bomb that just went off the background. What is it? You need to stop this call. I think there's more important things to worry about right now. So I was just like, shit. That was a bizarre experience, man.
Yeah.
I've not heard from them, so I hope they're okay. Yeah.
Well, we can use this podcast as a call, as an invitation for them to reach back out to you and let you know that they're all right.
Yeah.
But so, and Derrick, sorry, I'm just gonna dive in one last time on this topic from my side. But so again, clinical oncologist. In parallel, you're seeing a lot of femtech startups, MSK startups, brain health, dementia, etc. For you personally, and perhaps as a broader, let's say, proposition from AdoptADoc for the doctors or the clinicians that participate, would you say that the biggest value from AdoptADoc is for you to explore or to see what's happening in other medical fields? Or would you recommend AdoptADoc for doctors who want to, see a lot of the latest trends and innovation in their field?
So I think, so give me 1 second. I'm going to copy and paste one thing for you guys. So I've actually literally written an AdoptADoc guide for HealthTech consulting. Let me just share this and I'll copy link and I will just put it right in this chat. So I've actually written up a whole article on how I would approach HealthTech consulting. It's a very long-winded and there's a lot of questions because that's kind of a bit of the approach I take. I think it depends on the clinician. There is no hard and fast rule on what is what. So ultimately, what interests you? For me, I have unfortunately had to sit in a very generalist role, and I think I do quite like that. I do quite like doing a lot of different things. I've been asked to sit in a very generalist role because I have to, because for AdoptADoc, and the company, it's not just oncology companies that come up with me, it's often all these other people. So, but the funny thing is, there is a formula to this. When I've done so many consultations, I realized that actually there is a pattern to this thing. Every healthcare company, yes, they have their own unique proposition in a unique area. So let's say I am building a tool for endometriosis in the female health area, or I'm building a tool for rehabilitation post-sports injury, or post orthopedic surgery. Okay? I'm building something for that. So we all look at this sounds like completely different products. But if you actually look back and look at it, okay, so you're asking the same few questions. What is your intended use? Who is supposed to use this? What setting are you supposed to use this? Is this pre-post during diagnosis? Is it pre-post seeing a doctor? What kind of input will your product give? What kind of input does the doctor have to put into this product? Where does this product actually sit in their general workflow? Is it integrated into their current workflow? Is it a standalone program? Do they have to? Who are you selling to? Are you selling to employees? Are you selling to health systems? Are you selling to private doctors? Private clinics? And all these basic questions really are very important because it determines very immediately what kind of regulation and what kind of compliance that you want to go through. So, like, is this a medical device? That's a big first question. Is this a software as a medical device that you need to get a QARA or MHRA Class 2A regulation for? Or is this just a simple admin tool that doesn't need it? Is this going to be used in a healthcare setting? And that will, in the UK, there's the DPAC, there's the DCB 0129, there's all these things that you need to put in. Is this going to use, do you need GDPR for it? Answer is most often yes, you need to get GDPR for it. So it's really just about understanding this general pattern of questions to ask them, what are you exactly? And then from there you can extrapolate, okay, these are the things that you need to do or you must do legally to even think about selling or even running a pilot study. And then you can start, okay, we sort out this bit, and then let's see where that unique critical insight is going to help you. So yeah, there's a pattern to it. The more you do it.
Right. I think you'll have to honor your time, Derrick, because it's 9. That's right?
Yeah, it's 9 already. So thanks. Actually, it's 8 o'clock here, but
8, yeah, sorry.
Yeah, but I think I can hear my baby crying outside, so I probably should head off soon.
Yeah. Do you have any more questions, Marius?
I mean, the last question that I have, Derrick, is, as you know, I mean, the first time that I reached out to you was with an interest towards bringing AdoptADoc or introducing AdoptADoc in Belgium, in the Belgian landscape. I do think that a lot of young doctors especially, I think the younger doctors in particular will be really keen to join these kinds of initiatives because I do see a lot of them having an interest in startups or let's say in innovation in the broader sense. But what we do hear from a lot of them is that at some point it's just so overwhelming, this tsunami of pitch decks and which one is the right one to support, and I don't see what's new to this, and blah blah blah. So I do think that coming together on a platform like AdoptADoc makes a lot of sense, and will
there is strength in numbers. I think right now, I'm very happy building bridges. I really be very happy to work together with HealthTech Ventures, or with you guys specifically. It's we currently are fixing up our own internal processes to see how we're going to expand. So things are going very well so far. We're getting quite a lot of clients, but we're also reaching a point that, oh shit, we are really hitting our capacity as well. And we're thinking about, we need to expand the clinician network. We need to expand our own internal workforce as well. So I think around January, February is when we're really going to hone in on that and to actually get more clinicians on the team from different countries as well, in the European Union as well. But we also form partnerships with different organizations. In fact, today at 2:00, we have another conversation with another venture builder as well for eHealth, but they are very new in the United Kingdom. I'm more than happy in any chance, in any way, Marius, if basically eHealth Venture wants to form a proper partnership or like a community partnership with AdoptADoc or MCG, more than happy to facilitate that. Just let us know what are the terms. In terms of launching in Belgium, we'll probably need your help for that because we do not know Belgium very, very well. I'm sure I don't know the language as well. So and also, I think there's also a lot of unique compliance and unique standards that companies have to really adopt to in Belgium, as there are in the UK, as there are in Germany and in France. So I think there are a bit of nuances that we probably do need hands on the ground in Belgium to really understand that. And if this is something that eHealth Ventures is looking to expand into, more than happy to help in any way.
Yeah, for sure. But in the meantime, let's say Gianni or the many Giannis that we may have in Belgium are keen, to get started. How do they get in contact with you or with AdoptADoc? Is it? I mean, do you sign up?
I think for now, a lot of them are just reaching out to me. I'm just keeping. What it is right now is an Excel sheet. It's an Excel sheet with names and what they are and what they're interested in. But really, it's not that simple. I think there's. So here's a practical thing, okay? How many doctors are there and how many HealthTech founders are there? How many HealthTech companies that need help are there? I think the doctors far outnumber the number of companies out there. And oftentimes, there's no point in building up a huge community of doctors only to have nothing for them to do. It's often what we tend to do. We do a bit of a low demand kind of thing. We only reach out to clinicians if there is a job that's worthwhile their time to come upon it. So we do a bit of community building as well, but I think that will be more for January, February. But I think there will be more value to the clinician only if there's something that we can actually offer them, like a job to do or something or at a course you can attend. Well, we are building that up. We are building some educational material up as well. So yeah, I'm happy to take any calls from anyone who's interested, but also bearing in mind that I may not have something for them that quickly, especially if you're talking about Belgium, because our network is not that strong in Belgium.
Step by step.
It's going to be a long journey. For now, we are most comfortable in the United Kingdom, but we got to learn and we got to grow, isn't it?
Yeah, indeed.
Perfect. Thank you so much, Derrick. Thank you so much, Marius, for coming on the podcast.
Thanks, Derrick.
There was a lot of interesting new information for me because I've never really had anyone talk about clinicians joining companies to consult. So
everything I say or do, it's all on LinkedIn. I'm always very public about it. I don't try to hide anything. I don't try to talk about things that doesn't happen. So everything I do, it's all on LinkedIn. The people who comment, the people I tag on my posts, the founders I tag, they're real life human beings. So just have a look and connect, because oftentimes I find the comment section is more useful than the actual post, because they put in their own ideas and their thoughts.
Exactly. Perfect. No, this was a very like thought-provoking, interesting. So thank you very much.
Thank you for having me. I'm going to run right now because my day is starting.
Yes, go.
Bye-bye.
Bye, guys.
Ciao.